the must do here, I think, is just taking that really important role that medical affairs have to listen, to learn, and to bring that back to the company and hold on to that as being our reason, our purpose, our objective, and then ask our colleagues that support us from a legal and compliance perspective, those that are writing the policy, ask them to understand that that is what our objective is and how can that be facilitated so that everybody comes out of this, particularly the patient or a patient organisation, if we're going through the organisation, having had a really positive experience, and we've learned and continue to learn as time goes on. So that would be one. Probably another one would be about really once I've managed to establish, for instance, some of the working relationships with patient groups that represented patients, to be really making sure that the internal stakeholders understood this was not a one-off, 1 year commitment. It needed to be long-term. You can't just say, we're going to set up, for instance, I had a patient advocacy advisory board, and that had to run over a period of years to enable us to really work on the whole of that medicine development cycle. And so again, to keep people internally really, really motivated, it's fine. Of course, you have to have the buy-in from the outset, but there's that closing of the loop afterwards. So every time that we had insights to be shared, then it was our key stakeholders, our senior leadership, that were on the receiving end of getting those insights, not just buried somewhere in a system.